Good morning, merhabalar. We are here together with Sadık. He came from London, and we operated on him about like 3-4 days ago. When did you have the operation?
I had my operation on Thursday.
On Thursday, and today is what's the day today?
Today is Wednesday.
Wednesday, so Friday, Saturday, Sunday. Okay, he is at the 6th post-operative day today. And when he came to us, he had a BMI value of 47, and he was almost like 140 kilograms. And the reason that we are taking this video is to show non-Turkish speaking probable patients of ours how this whole scenario goes within the first week of surgery. He was undergone a sleeve gastrectomy operation. It was a straightforward procedure. We didn't have any complications. He didn't have much nausea or other complaints post-operatively. And he was discharged on day 3, as we discharge all of our other patients. So, first of all, I want to ask Sadık how he became of this bariatric procedures. I mean, how he became aware of weight reduction surgery, and how he decided to have this procedure.
My mom's friends came here to have this operation, and they really enjoyed it. They feel very better now. They lost a lot of weight, and I had weight problems. I work in a hair salon, and I stand up every day 10 hours a day, which is very hard for me with this amount of weight, and I decided to have this operation. And I really do like it because I've lost 10 kilos already in 6 days, which is a big difference for me. And when I lose weight, it's going to be much more easier for me to work. And even when I'm sitting in my car, it's difficult for me to lean down, stand up, and everything is better now.
Yeah, I mean, Sadık is very young, and he's only complaining about some stuff regarding being extremely obese, but also his lifespan will be extended almost 10 to 15 years after this procedure, since atherosclerosis and some other cancer forms, the risk of having cancer or the risk of having coronary atherosclerosis will be diminished from now on. And how was the first few days? And I mean, because basically this is major surgery, but it's laparoscopic. There are no incisions. So how do you think? Was it too hard, or as a person who went through all this stuff, how would you describe the first couple of days?
The first couple of days was a little bit painful, but I thought it would have been worse because it is a big operation. But it is better than what I thought it would be. And the 3rd, 4th day, I was standing up, I was walking around. I do feel like eating, but as soon as I have a couple of sips of my soup or anything like that, I feel full up, and which is better for me. And the first couple of days was painful, but the 3rd day, I was back to normal. I'm walking, standing up, had a shower, everything was normal to me again.
Because I'm sure you tried some diets before. Could you describe the difference between trying to do a regular diet and what's happening now? Because basically these procedures, all bariatric procedures, give patient a chance to do extremely good diet in a happy manner. You don't carve for food because your appetite goes down. Whenever you eat things this small, they are satisfactory, and between the meals you don't get very much hungry. As far as bariatric surgeons we know from the literature and from our patients. Do you feel the same? I mean, when you were doing a diet, it was more difficult, I guess. Now you don't eat much, but you are already satisfied. Is this true?
Yep, when I was doing my normal diet, it was very hard for me, and I couldn't see the change as quick as I saw it with this operation, which is better for me now because I've got more energy for myself. And with the normal diet that I used to do before, I've never lost weight like this, and this is helping me more because I can't eat. Even if I want to eat, I can't eat. With a little portion, I'm full up.
Sadık, what I'm going to tell you now is very important for the success of all of this project. You should never, you should always bear in mind that after a few years, the restrictive capacity of stomach will diminish. So you will end up realizing that, oh, I used to eat one köfte and it was enough before, but now my stomach is getting in like 2, 3 of them easily. Because after sleeve gastrectomy, after a few years, the volume of the stomach increases a little bit. So you should take care about that. And you should know every bariatric patient, every patient who has undergone a bariatric procedure should know that this is just the beginning. And after a few years, there is still a lot of things for them to do. There are lots of precautions for you guys to secure during all this walk towards normal life. You will lose like maybe 50 kilograms, 60 kilograms. Your BMI may be normal again. I hope it will be. But this doesn't mean that you can do whatever you like from now on. For the first few months and for the first year especially, our main goal is you reduce your weight in a healthy manner. So you should take your protein shakes and everything in the first couple of months. And after the first few years, then weight regain is a big problem, and you should always incorporate enough exercise in your life, and you should also work on your dietary habits, and you should never forget that. You should consider this operation is like a golden key by which you can open a very seriously locked door, which otherwise you couldn't. But once you enter from this door, a new life is expected. That's normal. But after a few years, you should always beware of weight regain, as almost 15 to 20% of patients undergoing this operation might regain weight in the future. You should always bear this in mind. Okay. Do you want to say any other thing? And
I'm happy that I've had this operation, and you'll be happy too if you do have this operation done. It is a success, and the professionals are doing this job very good, and I do advise everyone to have a look into this operation.